Hi, my name is Sudha Chandrasekhar. During the course of my career, I have established my own practice called Gateway Pediatrics, and I ran that for almost 15 years before I sold it to the local children's hospital. And when I was in private practice, one of my areas of interest was caring for children with medical complexity. And perhaps that was my segue into pediatric palliative care, because palliative care in children is a little bit different from palliative care in adults. Many of them are born with very complex, life-threatening, life-limiting illnesses. Essentially, what we're doing for them is palliative care right from the beginning, because many of these conditions don't have cures. So that was my interest, and by chance, I came across this program through the University of Maryland, and I had a meeting with Dr. McPherson, and I guess the rest is history. Probably not even 15% of the need for palliative care is being met now by our current cadre of palliative care physicians. So there's a very urgent need to train healthcare workers, not just pediatricians, not just physicians, but to train healthcare workers to serve the palliative needs of the community. So as an adult learner who's involved in online education, one has to be very self-driven, has to be very self-motivated. You have to do it for the pure love of learning. You learn from the wisdom of not only your peers, but your faculty members. And I feel like it'll make you a more rounded, well-rounded person in palliative care. For example, in my class, we had physicians, we had nurse practitioners, physician assistants, pharmacists, people who were working as hospice medical directors, social workers, chaplains. So we had such a wide variety, and they bring their life experiences and their perspectives to the discussion posts. So there's a huge amount that you can learn. You also make a lot of connections, because the people who teach this course and the people who take the course are often, very well connected out there in the community. I would have never been able to come to the NIH had I not known Dr. McPherson. It was her connections, it was her letter of reference, which I'm sure helped me to match at NIH. I remember my very first course in the spring term of last year was psychosocial and spiritual aspects of palliative care. Prior to starting the master's program, I had no intention of doing a fellowship. But I must say that was what really sparked my interest. And Jamie Goldberg and Denise Hess, they were the two people who taught that course. It was so eye-opening. I think it made me think of myself in ways that I had never imagined possible. For the first time in my life, I asked myself, why do I like being a physician? Why do I like helping people? What is it that motivates me to help people who are in pain, who are suffering, who are at the end of life? And just before moving here, when many of my patients, asked me, but why do you want to go to palliative care, And I thought, and my answer is, to help somebody live well is a privilege. But to help somebody die well, that's a gift. So if you want to learn how to be a gift to somebody, you should learn palliative care.